Namaste friends. Today we are here to discuss about an awareness regarding mental health related disorder. As most people know, the incidence and the prevalence of mental health related issues have been going up across the world, and we have a dearth of professionals who are there to deal with this. The reason for this increase has been manifold. Broadly can be classified as internal and external. Internally, inability to be educated about the mind, how the mind works and its handling is leading to major issues. Apart from that, externally, society pressure, cultural pressure, religious pressure and financial and economic, apart from work-related pressures, is adding to the stress, leading to this huge increase in the mental health disorders across the world. Now, it's very pertinent to note that most of these mental health disorders actually start very early in their age of a person. Most of them start between 16 to 25. Although there are many other childhood disorders and old age related disorders, the main thing is between the 16 to 25 years of age. It's very important to note that only after a person passes through a phase of mental health related difficulties, it will then percolate down into the physical system to cause physical disorder. As people know, it's not just the mental and physical health which are there. There are three other healths which are equally or even more important than these two, including economic health, social health and spiritual health. So in this context, it is very important to note that most of the lifestyle disorders that we are seeing, even in a younger population of late, is directly related to the mental health issues that we are seeing at a young age. So both from the point of view of catching or preventing the mental health issues in a younger population and also helping them deal with the lifestyle issues which is due to come in later on their life, it is very important to have an early intervention in most of these disorders. How to go about doing this early intervention? You have an approach based on medications and counseling. But as far as experience shows, this approach is kind of fairly limited. It is very important that we need to integrate approaches from multiple sectors or places in order that we can actually make a significant dent in the treatment and the prevention of mental health disorders. The bad habits that commonly constitute to an increase include alcohol abuse, drug abuse and the smoking or nicotine habits. So it is pertinent that we need to change the lifestyle patterns from these bad habits to certain good habits, including yoga, pranayama, meditation and regular exercises and other physical activities. It's also important that diet should be included as part of the treatment along with increased social support and economic support. If all of these factors are taken into consideration along with the family members, we would be able to provide a holistic approach to treat and prevent mental health disorders in the younger population. And I think that probably is the need of the hour in the society as such. I hope that this is going to help in creating awareness about the mental disorders in the younger population and people can seek help early without worrying too much about the stigma associated with these disorders. It is heartening to note that the stigma has been reducing in the society. However, we would still experience a lot of resistance and a certain degree of stigma is still there which prevents people from accessing help. So if we can make a dent in that over the course of the next few months in reducing the stigma and helping the people create awareness about early recognition and treatment of mental health disorders, including its prevention, we would have gone a long way from this year to the next year. Namaste.